Good morning, everyone. We'll start today's COVID press briefing with Dr. Alex Jahangir, who's our chair of the Nashville Coronavirus Task Force and chair of the Metro Board of Health. We'll also hear from Dr. Gill Wright, interim chief medical officer for the Metro Public Health Department, and Dr. Joanna Shaw-KaiKai, associate medical director, communicable disease control, infectious disease specialist with the Metro Public Health Department. We'll now begin with Dr. Jahangir.
Good morning, everyone. Thank you for joining us. First, I want to begin by saying that our 3 community assessment sites will be closed today due to the weather. Any help you can get in getting that word out would be appreciated. Here is the latest on coronavirus here in Davidson County. Total active cases today are at 1,930. Total cases since the beginning of the pandemic, 93,585, which is an increase of 149 since yesterday. And our 7-day percent average positive rate is 5%. This brings our rolling average of 14 days to 138 and our 7-day cases per 100,000 to 21. Our transmission rate remains steady at 1.04. Number of hospitalized patients in Middle Tennessee is now at 307, and Davidson County is at 183, which is a little bit of a bump from the past couple of reports we've given. And the total number of deaths in our city, there's 862. Now, so far, 166,031 Nashville residents have received at least 1 dose of the vaccine. And so that's close to 24% of our residents who've received at least 1 dose. And more than 91,000 individuals have been fully vaccinated, or 13.1% of our county. Now, of all of those 65 years and older, which is a group we've tried to be very intentional about, 66% of Nashvillians over 65 have been vaccinated. And specifically, when we break that down by race and ethnicity, 56% of white Nashvillians over 65, 48% of black Nashvillians over 65, and 59% of people of Hispanic ethnicity over 65 have received their vaccine. Now, this past Monday, we began vaccinating those 55 and over, and all those individuals in phase 2. I do appreciate that the governor announced that by April 5th, all Tennesseans over 16 can have access to the vaccine. And it is our intention in this county to also meet that goal and make the vaccine available to everyone no later than April 5th. As always, appointments for our city sites can be made by going to covid19.nashville.gov or calling 615-862-7777. We will be opening another block of appointments at the Music City Center site tomorrow. Also, as all of you know, there are many other sites available in Davidson County for vaccination. So health systems such as VUMC, the VA, clinics such as Matthew Walker, Salome Health, Neighborhood Health, Meharry Medical College, and pharmacies all over from Walmart and Kroger are available. Each of these places has its own process for vaccinations. In addition to these opportunities, as I think has been pretty widely covered now, there are many appointments available around our state. There's a great website, vaccinefinder.org, that one can go to and see where there's availability and how to sign up for vaccines around the state. And I think if you have the access and means to do this, I encourage you to get a vaccine as quickly as possible by whatever means you can. In other news, on Friday, March 26th, so tomorrow at midnight, we will progress in our city's next step in the city's reopening plan. Bar and restaurant hours will go to 2 a.m., which is an extension of an hour, with a maximum floor capacity increased to 175. Maximum indoor event capacity moves to 2,000, and high-risk events such as weddings, receptions, and parties will generally increase to about 175 attendees. We still will need to go through the public health process of getting these approved. Indoor party size moves to 10 from 8. Outdoor party size remains at 25. This is also true for restaurant seating capacity. We now have 10 people to a party. Attendees at indoor K-12 and rec league sporting events and tournaments will increase to 6 people per participant. And attendance at outdoor venues for these events is limited to 33% of seating capacity, provided one can properly socially distance. Now, outdoor arenas with controlled access, such as Nissan Stadium, Sand Amphitheater, Sound Stadium, and so forth, will increase capacity to 33% from where they currently are at 25. In close contact personal service business, such as salons, nail parlors, and the like, can go to 100% capacity provided that both the customer and employees remain masked during the interaction. In addition, when you review the order, you'll see we've removed certain stipulations that are broadly applied to commercial businesses for the past year, such as requirements for temperature checks will no longer be required in entry, nor will there be a capacity within elevators. So as you can see, we're making a great deal of progress on multiple fronts, and I'm grateful for everyone in Nashville for their part. And I'll turn it over to Dr. Wright, and glad to answer questions subsequently. Thank you.
Thank you, Alex. First, I'd like to thank everyone who helped at last Saturday's drive-through vaccine event at Nissan Stadium. Vaccinating more than 10,000 people at one location in one day was a first for Nashville. And overall, I thought it was a really great day. Saturday's event was a unique opportunity that was made possible by having a large supply of Johnson & Johnson vaccine. Johnson & Johnson had been holding vaccine while it was waiting for emergency approval. Once it was approved, we then received enough vaccine to hold this mass event, thanks to the Tennessee Department of Health. We don't expect another large shipment in the near future to do a second large based event. So we'll continue to focus on our clinic at Music City Center and providing vaccine to underserved communities of Nashville as possible. We're partnering with a large number of community-based organizations. With doing that over the last week, we've vaccinated more than 1,000 people in our underserved communities, neighborhoods. This includes faith-based locations such as mosques and churches, as well as community centers. Dr. Shaw-KaiKai will provide additional remarks on this effort. Moving forward, we expect Johnson & Johnson vaccine availability to be limited initially and slowly increase, just as we've seen the Moderna and Pfizer supply has increased in the past. Earlier this week, Music City Center increased their number of daily slots from 1,000 to 1,500 a day for new doses. We will continue to add slots based on vaccine supply. And I'd like to congratulate the staff and volunteers that started this when we were first in East Nashville and then moved into Music City, as this week they have passed over 50,000 vaccinations given. And they've been just doing an amazing job at that. The demand for vaccine in Nashville is still greater than our supply, and our team will continue to expand slots as available based on vaccine. As Alex already mentioned, vaccine is available through health systems and pharmacies, VA, etc. So there are a lot of other outlets available for it. Our number of vaccinated residents continue to increase, and we continue to monitor testing and confirmed cases. Schools were out last week for spring break. Beaches were filled with students and families. COVID cases are continuing to spread among popular spring break destinations. Those that have returned from spring break could be at risk for having been exposed. Even if you've been vaccinated, you may be able to spread the disease without feeling sick yourself. We expect cases to potentially increase over the next 3 to 4 weeks as a result of spring break exposures. For that reason, it's important to continue to wear your masks, stay socially distanced, and if you have a concern, get tested. Davidson County test centers are continuing to be open Monday through Friday, with the exception today because of bad weather. Now I'd like to turn it over to Dr. Shaw-KaiKai.
Good morning, everyone. Thank you, Dr. Wright. On behalf of the Communities of Color Initiative and the Metro Health Department underserved communities teams, I would like to give you an update of our efforts. This outreach would not be possible without our community partners and consists of COVID-19 vaccine education and vaccination events. Since January 4th, 2021, the underserved communities teams have administered approximately 8,076 doses of COVID-19 vaccine. This includes first and second doses for people with intellectual and developmental disabilities, low-income residential towers, and community events at multiple faith-based institutions, centers frequented by refugee and immigrants and the Black communities. At these events, we have administered 160 to 300 doses of COVID-19 vaccine. We continue to add community partners and outreach opportunities with the goal of making sure that everyone has accurate information and access to COVID-19 vaccines. This week, we administered vaccines at Hadley Park Community Center and also vaccines to eligible parents and guardians at a school with a high percentage of students of color from various nations. Due to predicted inclement weather, we have postponed today's community vaccination event. Saturday and Sunday, we will be administering vaccines at 2 predominantly African American churches. Friday, March the 26th, we are hosting a COVID-19 vaccine educational town hall. Excuse me. For more information, you can look at our Metro Health Department social media platforms. Nashvillians, we know you are tired, but let's continue to trust the public health experts. Get vaccinated, continue wearing your mask, practice physical distancing and hand hygiene to protect yourselves, your loved ones, and the community. Thank you. I'll now turn it over to Mr. Brian Todd. Or Dr. Wright.
Okay, we're going to go ahead and open it up to questions. It appears the first question was from Brett Kelman, so we will start there.
Good morning, everyone. Thank you for the updates. First, I was just going to say it would be very helpful to get the changes in business regulations and capacities in writing, just because there's a lot of them, and to be honest, they're kind of easy to mix up. Second, I had a question about how the city is going to use Johnson & Johnson vaccine going forward. I understand why the vaccine was initially used for the mass event and why, without another large supply all at once, it doesn't make sense to do another mass event. But obviously a 1-dose vaccine can be used differently than a 2-dose vaccine. So I'm curious if you're going to steer Johnson & Johnson to any particular sites, or if I end up going to Music City to get a shot, I might get Johnson & Johnson, I might get Pfizer or Moderna. Like, are you going to use the different vaccines in different ways?
Good questions, Brett. As far as we will be putting out the whole of the order with all the changes, so we'll get that out to you shortly. But as far as the different vaccines, for us, it's most convenient if we can use a single vaccine at a single site. We have less chance of making errors because we use one vaccine and don't give a second one, or which one we've got to give, and just it's much easier. But right now, we haven't received a supply this week, and we're not expecting one next week of any Johnson & Johnson. We do have a small amount left over from our initial supply, and we will be going out into the jails starting this week to use that in those, because obviously, for about only 10% of the people that are placed in our jails are still there after 10 days. So that would be a good place where we don't have to chase those people down. They can get a single dose, and that works well. I think that Neighborhood Health, in partnership, would like to use that also out in the homeless community, and particularly in the homeless campus. So,
Dr. Wright?
Yeah.
This is Tom. Can I just add one thing in reference to the first part of the question? The orders are now posted. I know Charles Starks had also asked about that. They're on the COVID-19 site under the public health orders.
Okay, good. So, all right. that's how we may use those differently, vaccine-wise.
No question there.
All right. Next up would be Julia Palazzo.
Hold on, is Brett still? Brett, were you speaking still?
I did want to follow up.
Okay.
If there is an increased supply of Johnson & Johnson, like in April, for example, do you think another mass vaccination event like the one at Nissan Stadium is on the table, or was that an event that's unlikely to be repeated?
I think that all things are always on the table. I don't know that we'll get a big enough dose to do that large again, but sure, if we had that kind of windfall, we would want to get it into arms as quickly as we can. That's an easy way to do it. The only thing I would say about that is that we need to continue to really focus on our minority, underserved communities, and that is not the most equitable way to get it into those communities, but it does get it into a large number of individuals. So would really want to look maybe more at smaller events in more focused areas where we need to get more vaccine into an area, maybe by a zip or something else. All right. Now we'll go to Julia Palazzo.
Hi, good morning, everybody. Just a couple questions, whoever feels best to take either one. So the magic number for this reopening this weekend, increasing capacity, I should say, was 20%. I know we're a little bit above that now. Is there another number in mind moving forward to increase capacity further? I know, the magic number was 70 to 80% to reach herd immunity, but are we going to see capacity restrictions, you think, lifted a little sooner? Perhaps if we reach 45%, 50%. And then just another question too, a lot of our rural counties in Tennessee are not filling up appointments. There's a lot of disinterest to get the vaccine in some of those areas. In response to that, I mean, number one, just your opinion on that. And two, will Nashville receive, more vaccine because of that lack of interest? Will the metro areas especially get more vaccine because of that going on? Thank you.
Sure. So maybe, Dr. Wright, if you don't mind, I'll answer this one.
Sure.
So, Julia, regarding reopening metrics, I think it's multifactorial, right? The more and more Nashvillians who are vaccinated, I think that's going to be really helpful to get us to the next reopening metric, and we'll announce those here as moving forward. But it's not just hitting a metric in isolation that's gonna cause us to move forward. I think you've all probably seen a slight uptick in cases and hospitalizations, which are manageable right now. But I think if we hit the next milestone, let's say it's 30% of first dose vaccine in arms, we need to look at this situation on the ground, just like we did when we hit 20%. And our hope is, yes, we'll continue to reopen more aggressively. But I think what is really critical for, I know, me and Dr. Wright and others on this call, to answer your second question, is we need to make sure every Nashvillian has an opportunity to be vaccinated if he or she chooses to. And I am very grateful that the governor did open up vaccinations to everyone, effective as no later than April 5th. I think surrounding counties that have capacity, I think I encourage everyone to use them. And I will say the state has thus far appeared to be living up to their part of saying they will look at allocations and allocate more appropriately for those places that have higher demand, such as Nashville, and they're doing that. And so with all those reasons, we have ways to operationalize giving more and more vaccines to people, whether it's through our Music City site, whether it's through other public health run sites, or through our community partners, which there are many of. So long answer, but in short, the more people get vaccinated, the safer it is for everyone in our community, and the quicker we can open up.
Okay. Next on the list would be Blake Farmer.
Thanks. This may be for Dr. Shaw-KaiKai or whoever wants to weigh in, but if I understood you correctly, over 65 residents, I mean, you're essentially saying the white and black residents, it's about 50% of folks vaccinated, which I would assume means that there's been a lot of catch up that has happened over the last few weeks. What was sort of the secret there? Is it these small events? Is it just folks needed time? Anything anecdotal you all could share?
It's multiple reasons. We've had the outreach events, and then we have our community partners. We definitely couldn't make that possible without, the community partners, and we continue to increase the number of partners we add on. And then, also the event at, Nissan Stadium. We've been working hard. The Nashville healthcare providers have been working hard and working together to make that possible.
It seemed like Dr. Wright, though, was saying that the mass vaccination events are not necessarily a great way to reach underserved. Not that all Black people are underserved, but did y'all look at the racial makeup of people who came to that event? Was it really a mostly white event?
I would say predominantly it was. We know to be honest, there still is the trust factor in the Black and brown community, and that's why we're doing more community outreach. So yes, it was predominantly more of a Caucasian event, but I know from some of the outreach we did that same day, there were some people of color who changed their appointment from the smaller event to the Nissan event. So not everyone's, hesitant, and that's a good thing. I think that means that we're doing our job and getting the information out there, and just increasing that trust in public health professionals.
And am I add to that, Blake, as well? I think Dr. Shaw-KaiKai doesn't give herself enough credit about the intentional effect of what she said. The day of our big event, we had an event at Lee Chapel AME, Connection at Casa Azafran. There's an event at Matthew Walker, I think this weekend, and there are a lot of these events, and I think all those add up, and that is really because of intentionality, and I think that's really a critical thing that this department has committed to, and Mayor Cooper early on committed to, and I hope as you're starting to see that will start showing in the data, and so we'll see how it keeps going, but I think it's going to be successful, and it's because of community leaders who are encouraging others to do this, right? And that's same reason in rural America, right? We want to see that in rural America, that trusted leaders in rural America get others in rural America to get vaccinated. So anyway, thank you.
Thank you.
All right, and our last question comes from Vivian Jones. Vivian?
Good morning, everyone. Thank you so much for this update. I had another metrics question for you. In the mayor's press release, I believe it was about 2 weeks ago now, where he outlined these possible changes that could occur when we hit 20% vaccination. He also mentioned that a further step would be taken when we reach 30%, and I know that we're at 23% now. Is there a plan to continue on planning on making further changes at 30%? And if so, is there a timeline anticipated for when we might reach 30%?
So I think as the plan was mentioned last week before, there is a plan, just like we hit a 20% metric, we now opened up at where we've just announced. We're making great pace, right? We were at 24%, 25% now. Our supply is getting stronger. Our operations are stronger. We want all Nashvilleans to get vaccinated as quickly as possible. Again, the second part of the statement last time, and what I said earlier, is we have to also look at the conditions on the ground. When we hit that metric, public health takes about a week after we hit the metric to assess how things are going, and hopefully if things continue to stay stable, then I think the intention is to move forward with reopening And gosh, I don't know. Hopefully we can get that next last 6% here fast, right? But I think all intentions are that the pace is going to continue to strengthen and not slow down, because I think demand still outstrips supply here in in Nashville. So I wish I could give you an exact idea of how many days that may take, but it probably is more days or a week or so rather than weeks to get 6% more. So I hope that answers your question. No,
I would just add to that, things on the ground mean things like what happens with our exposure because of spring break. If we see a big uptick in cases, that may change things, but hopefully we don't. So, we're just continuing to encourage the masks and social distancing, trying to prevent that from happening so that we can kind of move through as available. So, Brian, turn it over to you.
All right. Well, those are all the questions that we have today. Thanks everybody for joining us. Our next press briefing will be Thursday, April 1st at 9:30, and we look forward to seeing you guys then. Thank you.